Hi everyone, so today I'm going to give you a brief overview of the role of an RD in terms of infectious diseases. So infectious diseases, they're caused by pathogenic microorganisms such as like bacteria, viruses, parasites, or even fungi. They typically are spread through direct or indirect contact from person to person, but it also can be transferred from animals. So that's the zootonic diseases, spreading from animal to person. Some examples of this would be like AIDS, HIV, malaria, pneumonia, or even diarrhea is classified as an infectious disease. So some symptoms that typically occur if you were to have some type of infection, you may see a loss of appetite, anorexia, and what I mean by this is that they're not eating the adequate amount of calories that is needed to support their nutritional growth. So it could be poor weight prior to admission, and that would most likely lead to a more challenging recovery or treatment route. You could also have diarrhea, some type of inflammatory response causing the loss of nitrogen stores, so that could just be your muscle loss. Malabsorption, and then some possible links. Well, if you have food insecurity, typically you're not going to have the adequate amount of nutrition. You may not have access to those food groups that may provide certain types of nutrients for healing. And so it's shown that food insecurity has been linked worldwide to the transmission of HIV. So for example, there's different migration, lacking access to healthcare services, etc. Prior to and after treatment, it's important to have access to these foods, just like I had mentioned with healing and the progression of treatment. So looking at the micronutrients, macronutrients, as well as adequate caloric intake. So what I found here is a figure from one of the research articles that I found. And what it shows is that if you are undernutrition, this could lead to infection, or if you are infectious, you could have undernutrition. And it's just showing ways of how all this kind of relates back to getting an infection or being malnourished. So with food choices, when working in the hospital, we want to ensure that all of our patients are having adequate amount of calories, protein, and micronutrient intake. And so looking at what kind of foods are they eating? Are they eating more of the nutritional dense foods or more of the convenience foods that don't really have any nutritional background to support their health? Do they have access to safe water supply? This might be one of the background issues that we typically don't look at, but sometimes if they're not having water safety, it could lead to other potential problems. What are their food safety practices? Are they washing their fruits and vegetables before eating if they do have an infection? Are they cooking it to the correct temperatures? Are they cooking it all the way through? So there's multiple questions that you could ask these clients. So now going into the roles of a registered dietitian. Well, first we'll start off with their clinical assessment. So looking at their medical history, do they have any types of comorbidities that may alter their nutritional status along with the infectious disease? So do they have renal disease, hepatitis, diabetes, cardiovascular disease, etc.? Looking at different food and drug interactions as well as GI complications. So are they able to absorb certain nutrients, whatever it may be. And then looking at the nutrition-focused physical exam, prior to or during admission, do they have any muscle wasting, ulcers, infectious sores that you can see that we need to address as well as with the infection? Their dietary intake, looking prior and current to admission. What are their eating patterns? Are they having small frequent meals throughout the day? Are they just having a few meals? What's their current intake now during the hospital stay? And are they doing any types of supplements, including like Ensure, Boost, or even different types of like medicational supplements? With interventions, this would include setting different types of goals. So how many calories do they need, protein, fluids, in order to support their growth? Developing a nutrition plan would include some type of education to the patient so that they know kind of what we're going about and how we're dealing with the infection. That would go hand in hand with some counseling. Dietary modulation, so just changing their types of foods that they're getting, or even adding more supplements in order to meet their needs. And then you might also want to become familiar with the community resources that there are available to them, because say if they are low income, you want to know what types of community benefits they may have in order to get the food that they need. Next would be the monitoring evaluation. So looking at weight status, monitoring it throughout their stay. So do they have any muscle wasting, any weight loss, weight gain, etc. Looking at their food intake during their hospital stay. So sometimes dietitians may do a calorie or protein count to ensure that they're getting adequate calories as well as protein throughout their stay. Looking at how much of a meal are they eating, so certain types of percentages that we may have some people track. If supplementing, making sure that the patient enjoys them. I know as all of us have worked in the hospital setting, a lot of patients either do like them or don't, so just kind of touching base with them to see how they're liking it, if they'd want to change to a different supplement that would meet their needs, or whatever it may be. Checking to see if they also have GI complications. And so what do we really focus on? Well, we're looking at their caloric needs. This could be through oral intake, enteral, parenteral nutrition, whatever it may be, in order to get calories. So looking at muscle maintenance, if they have an improved immune system, improved quality of life through this caloric intake, and then we can adjust it based on their needs. With protein, as you may know, it's essential for the maintenance of body mass, cytokine production, so that would be like your different types of immune systems. So cytokines are the proteins that are secreted by immune cells, which act as the signaling cells when there is an infection. And with risk of infection, protein needs are definitely going to be a bit higher, especially if they have different comorbidities such as like ulcer. It's going to be a bit higher. If lacking protein prior to admission, we typically will need to increase need for dietary protein, and that could be through supplementation or food if they're able to eat that certain amount. I also found an article that talked about different vitamins and minerals that may be adequate during an infectious disease. And so with vitamin A, they found that it may be reduced during respiratory infections. And so vitamin A helps with the epithelial and bone formation, cellular differentiation, as well as immune function. Vitamin C is important, as we all may know. It helps with collagen formation, immune function, and it acts as an antioxidant. Vitamin B12, it helps support nerve and blood cells to make them healthy, as well as creates different DNA. And so this one is typically one of maybe the most important vitamins because, as you know, our blood supply, we need a lot of healthy cells in order for us to heal. And lastly, iron. They found that iron may help reduce the activity of pathogens and aid in the treatment of infection. So for the preventative care of patients after they're being discharged, we want them to minimize the amount of time spent in crowded areas. Probably have heard this with the coronavirus that's going around. Consume more nutritionally dense foods. So that would be like your whole grains, fruits and vegetables, lean protein, just so they do have adequate amounts of a variety of food, as well as vitamin, minerals, etc. We want them practicing good hygiene. So that's washing your hands or washing the vegetables or fruits that you come encounter with, or maybe even washing counters more often than you need to. All right, well, here is my references. Thank you all for watching.